The effect on patients when they know that they have to go through a series of steps in order to get the correct medication can be devastating. And the first thing that's experienced, of course, is an incredible frustration. And the lag time to when they're going to get their effective treatment through a fail-first policy also creates depression and often a sense of hopelessness. You've got patients who are already in a fragile or compromised position. They don't feel well, they are suffering the symptoms of whatever the disease, and now they have to go through another series of obstacles in order to get treatment. This can cause some patients to give up, to self-medicate, to use medications that they have used before, and also to use things that are not medications in order to deal with the symptoms and the pain. And it creates difficult habits to break. The wait time also increases, and the way I think about it is a record. We used to have records where you'd put needles in, and if you left it running on the groove, it would deepen it and deepen it until you could no longer play the record. And I think that's what often happens with symptoms. They get worse and worse, and what I'm talking now, of course, are the emotional symptoms, the reactions to the disease, so that you're often trying to help somebody create a plan to be an effective patient, to take responsibility, to react in a way that is better for them than the frustration or the anger or the hopelessness or the helplessness. But that groove deepens and deepens the more obstacles they have to go through. And they lose their endurance, they lose their persistence. It becomes very difficult for them to take the actions they need to take in that kind of situation.